This is part 2 of the discussion on epidemiologic measures. And in this section of videos, we're going to discuss measures of mortality as stated here in great detail. So there are 3 types of mortality rates. There are accrued rates, specific, and adjusted. And we're going to discuss all 3 of those now. But essentially, the difference between accrued and the other 2 is the other 2 are adjusted for some factor or some distribution of factors in the population studied. First, I want to talk about annual all-cause mortality rate. This is the number of persons dying from any cause in a 1-year time period over the number of persons in the population generally chosen at the mid-year. And the reason for that is that represents just the average number of persons in a population in that 1-year time period. This is a rate. It's usually expressed as a number of persons, and it's almost always standardized. So, for example, if we standardized a rate per 1,000 persons, we would take that measure and multiply it times 10 to the third. And the reason we standardize these measures is so that they are comparable across different sources. The next mortality rate I want to discuss is age-specific. And for this particular example, we're looking at the annual rate per 1,000 persons of children who died under the age of 10. So in the numerator is the total number of deaths from all causes among children younger than 10 years of age, and the denominator now would be the number of children in the population younger than 10 years, and again we would choose the mid-year population size. And again, this would be standardized per 1,000 persons, if that made sense numerically. So the next example is cause-specific mortality rate. In this particular example I'm presenting has to do with all deaths in 1 year associated with lung cancer. And so again, that would be the number in the numerator, would be total number of deaths in 1 year from lung cancer, and then the denominator would represent the number of persons in the population at mid-year. We can also calculate cause and age-specific mortality rates together, or combinations of various mortality rates. In this one example, I'm providing the annual rate from leukemia among children less than 10 years of age. And again, the numerator would then just be children who died from leukemia and who were less than 10 years of age at time of death out of the total number of children younger than 10 years of age at mid-year. Now notice here the denominator consists of all children, not children necessarily who have leukemia. That's an important thing to note here when it comes to mortality rates. Now, some important concepts specific to mortality rates are that the denominator equals the number of people at risk of dying. So anyone counted in the denominator must be at risk of becoming an event or a death in the numerator. And the time period is arbitrary, but must be specified. And as I noted already, most often the time period for mortality is 1 year. This is a good index of the disease severity and a measure of the risk of disease, as well as can approximate incidence rates when the case fatality rate is high, and I'll discuss case fatality rate in a moment, and when the duration of the disease is short. So again, overall annual mortality rate can be an indirect measure for risk when these 2 conditions are held. So now I want to talk about case fatality rate. This is an important measure in epidemiology, and despite the naming, it really isn't a rate, but in a sense a proportion. And the case fatality rate represents the number of persons dying of disease after the disease onset over the total number of persons with the disease. And again, this measure is presented for a specific period of time, and it's expressed as a percentage, unlike the other measures that I presented, which are expressed as rates. Because again, this isn't a rate really, it's a proportion. Important concepts with respect to case fatality include that it measures the severity of disease. It is most commonly used in infectious diseases or for diseases with short periods of illness. And the denominator is limited to persons who already have the disease. And so again, that's very important to discriminate that from the overall mortality rate, which again includes in the denominator all persons in the population who are at risk of dying, regardless as to if they have the disease. And as I said, despite its name, it's commonly expressed as a percentage. So here's an example of last year's hepatitis outbreak that was occurring in San Diego. At one point in time in September, the case fatality rate was 16 out of 421, or 3.8%. Again, among 421 individuals infected with hepatitis A in San Diego, 16 had died. The next concept is proportionate mortality. And as the term sounds, it's basically implying the proportion of mortality associated with a specific cause of disease over the total number of deaths in a population. And again, what's important to note here is that the numerator and the denominator are using the same time period of, in this case, 1 year. And the denominator in this instance comprises all deaths. So important concepts about proportional mortality are that it's usually expressed as a percentage, and it's useful in terms of providing a quick look at major causes of disease, but it doesn't yield anything with respect to the overall risk or incidence of dying. That's what mortality rates provide us. Now I want to talk about some specific measures used in mortality regarding neonatal mortality and maternal rates of mortality. In this case, I'm talking about the NMR, or neonatal mortality rate. This is a measure that's commonly calculated and used to compare values across different countries or regions in the world. The numerator for this measure consists of the number of deaths among children who die within the first 28 days of life, and the denominator represents the total number of live births during that same time period, and it's standardized again. This is generally calculated on an annual basis and often expressed as a rate per 1,000 persons. There's also the post-neonatal mortality rate, or PNMR, and this represents the number of deaths among children between days 28 to 1 year, over, again, the number of live births during that same time period. And then finally, we have infant mortality rate, again, a very commonly used measure in global epidemiology. Here, we're looking at the number of deaths among all children under the 1 year of age, or during the first year of life, divided by the number of live births during that same time period. Now, because the numerator can include children born in the prior year, this is not a true proportion per se. It is, as with the other measures, generally calculated on an annual basis. It's a useful measure of health status of both the mother and the infant, as well as an assessment of the overall care of the mother and the infant, both pre and post delivery. We also use this measure to compare different nutritional standards, sanitation, healthcare programs across countries or regions. In the United States, just as a side note, the estimated IMR in 2016 was 5.6 per 1,000 live births. The country with the highest infant mortality rate in 2016 was Afghanistan, of a value of 112.8 per 1,000. These are data from 2013 to 14, presenting the number of infant deaths and the percentage of total infant deaths and infant mortality rates. And this is just to provide you with kind of a sense as to of the United States. This is just to provide you with a sense in terms of among the deaths, what were the deaths due to? So this would be useful to calculate proportionate mortality. These are just data from 2016 illustrating the change in infant, neonatal, and postnatal mortality since 1940 in the United States, clearly illustrating a dramatic decrease in those measures, largely driven by, of course, the improvement in healthcare, improvement in pre- and postnatal care, and a lot of other factors. So now I talk about maternal mortality rate, or MMR. This represents the number of deaths during a time period among pregnant women or within 42 days after termination of a pregnancy. over the total number of live births during the same time period. This is generally standardized per 100,000 because the numbers are less or lower than that for the infant mortality. This is an interesting figure from a recent publication illustrating that among the 25 countries with the highest income capital, or the highest income, that Washington, D.C. and the United States and Washington, D.C. represent the capital and the country respectively with the highest infant mortality rate per 1,000 live births. This is an alarming figure and certainly raises concern about the general care of infants and pregnant women in this country. There are multiple factors contributing to this within the country as well as specific to Washington, D.C. So now I want to talk about a measure called Years of Potential Life Lost, or YPLL for short. And the idea being that death at younger ages is associated with a greater loss of future productive years. That should be somewhat obvious. So if you die at age 20, there would be more years of lost of productivity versus having died at, say, age 80. And the way this is calculated is using the number of deaths multiplied by standard life expectancy at the age of death. This is often used to quantify both social and economic losses in a region or a country that's associated with premature death. It is generally estimated based on average life expectancy in a population, but that varies across countries. So in the United States, it's 75 years, but clearly it would be lower in some developing countries. And the link I'm giving you here allows you to go and calculate the YPLLs for different countries and different groups in countries. So this is an example of the years of life lost before age 65 in the United States associated with all deaths, and this is among females, and it essentially provides us with the number of the years of potential life lost. So of all causes of death, the total years of potential life lost are approximately 4 million. And then this gives you a more specific breakdown by cause of death. And again, this is a useful descriptive approach for epidemiologists to try to identify patterns of disease or mortality that are happening in our country or other regions that we need to pay attention to, or to look for trends that we hadn't seen before. So for example, most recently, there have been increases in the overall number of opioid-related deaths, and the overall life expectancy in the United States has decreased by a few years, and that's largely attributed to the increased number of deaths from opioid addiction. And then this is the same sort of data for males. And what is interesting to note here, though, is for all causes, the years of potential life lost among males is almost twice that for females. Here it's 7.2 million compared to the 4 million estimate for women. And this is obviously driven by a lot of things that are different between men and women in terms of lifestyle, occupation, etc. So the next concept is the disability adjusted life years, or DALYs for short. This is a measure of disease burden expressed as a number of years lost due to ill health or disability. It's calculated as the sum of years lived with a disability and the years of life lost as a result of that disability. This isn't really an economic measure per se, but rather than one of a healthy life lost. And again, it's useful for public health purposes. I'm giving you a link that provides you with access to data from an English database, a database in the UK that a very useful database, frankly, that allows you to explore patterns of DALYs.